This is Dr. Doctor with Dr. Thomas McGovern and Dr. Andrew Mullally coming to you from Redeemer Radio Studios.
Today we have the pleasure of interviewing the two editors of a groundbreaking book called Catholic Witness in Healthcare. First, we have Dr. John Traveling. He's a Catholic deacon and an internist specializing in critical care medicine at Temple University in Philadelphia. Welcome, John.
Thanks, Tom.
And also his co-editor is Louise Mitchell. She's a bioethics professor and associate editor of the Lineker Quarterly, which is the medical moral journal of the Catholic Medical Association. Welcome, Louise.
Thank you for having me.
So, why is this book so groundbreaking, John?
Tom, I think this book is so groundbreaking because it really brings out there to the public a textbook that is very rich in Catholic ethos as concerning healthcare and particularly medical practice. You know, in preparation for this book, we had surveyed the genre, and, you know, it's not that hard to find books, textbooks, scholarly work written by Catholic moral theologians, Catholic ethicists, and so on. But what this book really brings to its audience is a book that addresses many of these issues, but is importantly written largely by practicing faithful Catholic physicians. There are 25 contributing authors, and nearly half of them, 12, are actually practicing physicians. And we think this is really a significant contribution that this book brings to this area.
There's a very, very dynamic foreword written by someone that Andrew and I know well, Dr. Ashley Fernandez, who is a pediatrician and medical ethicist in Columbus, Ohio. And I want to quote a short part of it. I really enjoyed reading what he wrote. He said, "For 2 decades, I have hoped for a written tool that would demonstrate the harmony of faith and science in the practice of medicine. Traveling and Mitchell, along with their authors, have delivered a gift to the Church and something that is necessary to help educate our next generation of Catholic healthcare professionals." Louise, how would you say that your efforts are a gift to the Church?
Well, just to follow up a little bit with what John was saying, I teach a course in clinical medicine and bioethics for the University of Mary in North Dakota. When I was developing the course, I was looking around for a textbook on Catholic clinical bioethics. So, you know, in the doctor's office, rather than just theory and practice, and I couldn't find one. So, in that way, this book fills a void, something that we need.
So it gives us something practical to use with patients. The National Catholic Bioethics Center does a fantastic job with training in philosophy and ethics, but this fills a void that we need with patient care, doesn't it?
Yes. It's fine to know all the theory and the principles, all the Catholic truths. But when you're actually in the doctor's office, how do you put them into practice? How do you actually talk to patients in a manner that respects their God-given dignity? And this is part of what this book does.
That's been a reoccurring theme that I've had a chance to talk to folks about is what does it actually mean to have Catholic healthcare or provide the Catholic witness? In another show, we interviewed Dr. Jonathan from Wichita about the ethics and religious directives of the Catholic Church. How does your book work to build on what we know from the philosophical and the moral teachings of the Church, and how does that witness of Catholic health fare, you know, especially the uniqueness of it, how does that brought to the patient's bedside? John, I know you, especially practicing in the ICU, you get to work with this on a daily basis. How have you witnessed the Catholic difference, and how do you bring that to light in the book?
Well, throughout the book, many of our authors have referenced and excerpted segments from the ERDs, the Ethical and Religious Directives for Catholic Healthcare, and that's all important. But they go beyond that. Many have provided through either case-based or just personal experience of their their work as clinicians and have shown how particular directives may be concretely applied in particular circumstances. Again, drawn from these faithful practicing clinicians, from their experience, how to apply these principles. So this is part of what this book brings and offers, and how it is different than just going through the ERDs, for example, and saying, okay, I get what the church teaches or what the guidelines are for ethical healthcare, but this goes beyond in that it again takes the experience and the witness of various clinicians to the audience.
If you just joined us, you're listening to Doctor on Redeemer Radio, where we are discussing the book Catholic Witness in Healthcare with the book's two editors, Dr. John Travaline and Louise Mitchell.
Louise, while you guys were starting this project, I love the idea and how it hatched out of a real need. Did you guys find it difficult to engage others, the many authors you guys have collected, in helping with this project?
Well, I joined the project kind of in the middle, and so maybe John has more insight into that.
It really wasn't terribly difficult to recruit authors for the chapters, our vision that we had. I think faithful practicing Catholic docs and others in the various fields are excited about what they do and have an inclination to want to share that with others. So, the initial conception of the book and sort of outlining what we thought would be good chapters and topics to present to an audience, and then looking at people that we knew largely from the Catholic Medical Association, but some other connections we had professionally and knew of others. It really, as we approached them, almost everyone had agreed to share their experience. There were a few people, because of time constraints, that couldn't commit and didn't, but they were very few.
I've been involved in contributing to textbooks as a chapter author, and know it's often a several-year process. How long did this book take to assemble?
Oh, longer than I would like to admit. The idea was as conceived. I just in a little preparation went back to an email and a meeting agenda that I had devised back in for a meeting that we had in February of 2010.
Oh my!
To discuss the feasibility of this. This was after then president of the Catholic Medical Association, Dr. Raviel, had suggested that maybe we needed to come up with a book that spoke to Catholic clinicians in medical ethics. And so, it goes back to some feasibility meetings and discussions, sort of assembling potential topics and authors, proposal that I had drafted and then submitted to. Part of that process also, of course, was trying to pitch to various publishers among maybe 3 or 4 that I had pitched to. Finally, the proposal was accepted by the Catholic University of America Press in April of 2011, so almost a little more than a year later. It was accepted in 2011, and then went into more not serious but earnest production with the assembly of the text, and it was finally accepted for publication in March of 2016. So just to give you a rough sketch of the timeline there.
So this tells me that there is something in business psychology and business practice known as grit. There's a book by Angela Duckworth by the name Grit. John Travaline has grit. Thanks be to God. Now, in the foreword of the book, it says that this book is meant to be accessible to the, quote, learned lay person, as well as those who practice medicine, students of the health sciences, and philosophers and clergy who require a scholarly, practical guide to authentic Catholic medicine and ethics, end quote. How in the world, John, were you able to appeal successfully to this broad group of individuals?
great question. There's a certain complexity to the book that each, or at least most of the chapters, they plumb certainly the depths of their particular clinical content, but there's another dimension to many of the chapters that reach out, and we're seeing already an appeal to others who are non-clinicians, let's say, because the author in the particular chapters will touch upon the ERDs, for example, as I alluded to, or will look to relevant scripture, will look to relevant magisterial teachings. For example, the chapter on the Catholic pharmacist, until I read the draft of this, did not realize that John Paul II in the early 90s had given an address to Catholic pharmacists specifically. So just as one example. So the authors, in addition to going deep into their particular clinical content, reach out and touch upon these other sources that help inform Catholic practice.
You had mentioned the variety of different authors. I know, Louise, you guys have physicians, nurses, a medical student, priests, philosophers. Tell us about some of these authors that you guys were able to compile, Louise.
Well, I could tell you one story. We had one of our chapters drop out, and we were looking for another one to fill in the spot. And I came across a pamphlet for a new course in Catholic psychology and counseling at the John Paul II Institute for Marriage and Family in Melbourne, Australia, and contacted one of the instructors about contributing a chapter, and there was immediate interest. And that's how we got Dr. Wanda Skaronska and the Chapter 11 on Catholic psychology. So, John, how about some others?
Again, through associations, professional contacts we have, just knowing others through the Catholic Medical Association.
But besides the physicians, what kind of professionals do you have, John?
So I came to know Dr. Pete Colosi, for example, through some connections in the field. And Pete is a moral philosopher, was teaching at the seminary in the Archdiocese of Philadelphia at the time, and recruited him. And he's a very articulate, fine writer, and presents very clear thinking in his thoughts, and is able to communicate well with others, and had a particular interest in medical ethics and taught such at the seminary. So it recruited him, for example. Others, Jerry Palazzolo, who's the president and CEO of Catholic Healthcare International, we had gotten to know through associations. And Jerry's background as a medical administrator, having worked for decades in healthcare administration, founding a Catholic Healthcare International, which has I hope we can get to talk to about a vision for authentic Catholic healthcare, modeled after the Casa Sollievo della Sofferenza, the House for Relief of Suffering in San Giovanni Rotunda in Italy, the medical institution center founded by now St. Padre Pio. So
and John,
reached out to Jerry for some contribution, and I think a phenomenal chapter as well.
John, we'd like to hear more about that CASA model. We're going to go to a brief break, and we'll be right back after the break with more Dr. Doctor on Redeemer Radio, a trustworthy source of medical information for Catholics. This is Dr. Doctor with Dr. Tom McGovern and Dr. Andrew Mullally, coming to you from Redeemer Radio Studios.
We're interviewing Dr. John Travaline and Louise Mitchell about the book they co-edited called Catholic Witness in Healthcare. John, I'm the same age as you, born the same year, and during my training, if I ever came across the term Catholic medicine, I thought it only dealt with the beginning of life, or reproductive ethics, and end-of-life ethics. But as I've learned, thankfully, Catholic medicine is so much more than that. It's not just about opposing what is immoral in medicine, but more about nourishing the health of the whole person. in truth and love complemented by faith. Is that part of your vision for this book?
Absolutely was, Tom. That vision that there is so much more than just these key popularized issues that surround beginning of life and now more so end of life. There's so much more in between in terms of the practicing an authentically Catholic ethos as we encounter patient after patient.
Louise, how is the book organized?
Can I just follow up on what John was saying there? Following Christ, being a Catholic, is about being the best you can be, doing the best you can. And so opposing what is immoral is just a minimum. You end up saying, how close can I come to breaking the law without actually breaking it or something like that? But
Yes.
Jesus calls us to much more than that, to be holy as your Heavenly Father is holy. And so it's not about minimums, it's about excellence, imitating the saints in Christ. And so in this book, that's what we're trying to do. We're trying to talk about excellence in patient care, not just about avoiding what's immoral. And we've organized the book in 3 different sections. The first one is some of the foundational issues. There we have a theologian, a philosopher, and a priest talking about the biblical background of healing and healthcare, talking about Christian anthropology and the sacraments. We have the largest section on witness, on practicing your Catholic faith in medicine. And this is where we have all the different specialties and doctors talking about how they serve their patients in their particular specialty. And the last section is on how do we shift the culture? How do we actually make medicine Catholic? How do we evangelize without turning people Catholics? We give them good examples as such, like the Casa from St. Pio.
So, Louise, do you have any favorite chapters?
Well, I have favorite sections of chapters. I mean, it's so, it's hard to pick anything.
What's one of them?
Particularly, Wanda Skronska's chapter on psychology, where she talks about forgiveness, but especially her section where she talks about suffering. And she says, God has given suffering an extraordinary dignity. So what Christ, he suffered for us. When we offer our sufferings to Christ, we participate in the salvation of others, it says in Colossians. And so many people think that suffering is just something to get rid of as fast as possible. And the Catholic view is, yes, that's fine to take pain medication. At the same time, we should offer up our suffering to help others. We should use it as prayers for others.
John, are there any chapters that you guys were able to edit that have never really been addressed before? And you got to ask, why hasn't this been talked about before?
Yeah, Tom, I thought Dr. O'Hara's chapter on pediatrics and witness in pediatric care was remarkable. It was one of the true gems of the book. He goes into very specific, prudent recommendations to give to parents at all stages of a child's development, and it was just so well done. It was so richly Catholic. I particularly, as Louise said, sections of chapters. In that chapter on pediatrics, I was particularly struck by his discussion about character formation, particularly during the adolescent years for children, and then using very concrete examples, nice treatment of chastity, for example, nice discussion on HPV, human papillomavirus vaccination, and so on. So that was one of my favorites, although, as Louise suggested too, and there's so much richness there that really altogether the book is quite special, and it's hard to be favorites. It's sort of like this one.
Your children, yes.
Yeah.
Yeah.
If you just joined us, you're listening to Doctor on Redeemer Radio, where we are interviewing today Dr. John Travaline and Louise Mitchell, editors of the new groundbreaking book, Catholic Witness in Healthcare. Well, I thought it might be good to go through some of the chapters that particularly struck me to find out what is in here that might interest the learned lay listener, as well as some of our medical professionals. So in Chapter 2, Catholic Anthropology and Medical Ethics, Louise, what is anthropology for those who are not familiar with the term?
The study of the human being. And it's more than just studying your culture or studying how you live, but what is the human being? We talk in Catholicism and St. Thomas Aquinas about the human being being a union of body and soul, and that is anthropology.
And why is that necessary in today's culture? Have we forgotten what a person is?
I could come up with so many examples of why it's necessary. There's such a misunderstanding of anthropology today. Just some of the extreme examples. Peter Singer at Princeton talks about killing 2-year-olds if their parents are inconvenienced by them. There was an article in the Journal of Medical Ethics about why do we use the word abortion just for before birth? Why not after birth abortion? And a few years ago, there was an article in the British Medical Journal called Dignity is a Useless Concept.
Oh, my gosh.
It's no different from respect for persons. And all of these have a misunderstanding of the human person.
So all the decisions we make ethically will flow from what we think a person is and what a person is for.
Yes. And Peter Colosi's chapter brings out that the human person is self-transcendent. We can go beyond and above ourselves. For example, in order to be excellent as something, you have to know that you're not yet excellent, and that excellence is possible. And so we are self-transcendent. We are unique. Dr. Colosi talks about our uniqueness. Each and every single person is an absolute, individual, unique human being. And he also talks about relationality. We're all in relationship with others. You know, in today's culture, we talk about autonomy and doing your own thing and making your own choices. It's impossible to be autonomous, totally autonomous, because in order for you to have your desires fulfilled, someone has to help you out, or you have to maybe purchase the latest gadget from the store, so there's people involved. Well, we're always related to human beings, and they're always helping us achieve our desires or keeping us from them. And so we're relational.
It definitely makes sense why that has to be the foundation of the whole book, to kind of explain where, especially as Catholics, we're coming from. One of the chapters that caught my eye, John, was Chapter 7, the Caring for Older Adults. I know many of our listeners have the responsibility and the opportunity to care for loved ones and maybe aging parents. Sister Mary Diana Drager, who's a physician and a Dominican nun, I'm sure she wrote a great chapter there that I'm going to look forward to reading. What can you tell us about that chapter, Caring for Older Adults, John?
Well, both her and Dr. Powers very nicely go through some of the important, again, it's a very practical, relatable to many people, I think, through a case-based analysis. They present 3 or 4 cases, various scenarios of challenges that are faced by caring for older adults, you know, whether it has to do with dementia, and whether it has to do with patients, parents no longer being able to live in their home and now requiring an assisted living situation, and just the various challenges that these circumstances pose for people. And what a truly Catholic abiding ethos is for encountering these circumstances.
It definitely seems as though they're, you know, with the whole circle of life and with the whole life trajectory, you go from being completely dependent to one responsible, and then frequently at the end of life dependent again. That's a tough role, I think, a lot of times for children to take on that role of being the caregiver. But I am interested in talking to Sister Mary Diana more. I know we're going to hopefully have her on our show in the near future.
She is scheduled on this topic, yes.
Yeah, I think that'll be a great opportunity. That's a good topic. And another topic I saw that interests me a lot in family medicine is the spiritual perspective in rehabilitation medicine, which deals a lot with pain control and rehabilitating folks, especially in the modern area of chronic pain. And Dr. Jose Santos wrote this. What can you tell us about this chapter, Louise?
I thought one thing that struck me about this chapter was it was somewhat different from the other chapters. Dr. Santos actually says to use faith as a therapeutic tool. So if your patient is open to it, to talk to them about their faith and how their faith can be involved in their recovery process. And I thought that was very interesting. And he also talked about looking at the whole person, body, soul, spirit. So those, I think, made it a unique chapter.
And he, like John, I believe, is a deacon, or at least in training to be a deacon, isn't he?
Yeah, no, that's
Yes.
correct. He was ordained.
And,
spoke with him subsequently. He was just ordained this past June, I think, of 17. Yeah.
Oh, thanks be to God.
Yeah, praise God. Yes.
Yeah, and rehab medicine deals with some very challenging medical problems, and usually chronic and difficult.
Absolutely.
Well, we're going to sign off for this segment, but we'll come back for more since there's so much more to talk about here. For now, this is Dr. Doctor on Redeemer Radio, where we discuss health matters because people matter. We have the pleasure of continuing with the editors of Catholic Witness in Healthcare, John Travaline and Louise Mitchell, our discussion. And we've been working through some of the chapters of this book, and we're up to a chapter on the Catholic pharmacist. Now, what possibly could be of interest or importance to pharmacists from a Catholic faith perspective, John?
There are many issues, and I'll just briefly to give you a flavor of this. Doctors Flanagan and Mangione outline a short list of the issues related to that are relevant to pharmacists. Issues related to contraception, such as the sale of condoms and dispensing of contraceptive or abortifacient drugs. They touch upon providing oral syringes to individuals who may be addicted to injection drug users, and they touched upon lethal and preparing injections as pharmacists for lethal drugs used in some states for capital punishment, execution. They touched, interestingly, on the sale of cigarettes in commercial pharmacists who may have pharmacy stores where they're dispensing other substances or selling other substances. Actually, the sale of cigarettes in a pharmacy, in view of the adverse effects of cigarettes on patient health. So, interestingly, as you plumb into this, the content of pharmacy from a Catholic perspective, all sorts of issues come up, and I know there are others as well. So.
And before I forget, Louise, this 513-page book can be purchased where and for how much?
Amazon.com, Barnes & Noble, all your local book places, $45.
$45.
We'd be happy to have you purchase more and spread the word. Put up reviews on Amazon.
Ah, that's a good point. Yes, $45 for a textbook of medicine of 500 pages is a deal and a half. That's incredibly inexpensive for what you get in this. Chapter 13 is my favorite. It's on the formation of medical students, written by Anonymous. John, what is the genesis of this particular chapter?
A medical student who was in my medical school, we would gather as part of a Catholic Medical Student Association, particularly impressed me with the ability to see integration of faith, a very vibrant, robust faith life with medical education as the students as they were going through medical school at our institution. And as this book was being conceived and organized and approached, that I felt that this would be an important topic to convey to others, how to blend one's formation as a medical student with ongoing formation in faith.
Tom, aren't you working on an initiative right now with the CMA to help the medical students in faith formation?
We're working particularly with pre-med students. And I'm wondering, John, if this chapter wouldn't serve as an incredible introduction to medical school for the Catholic pre-medical student. Have you thought about possibly using it in that way?
Tom, we have, as you know, the Catholic Medical Association is very much involved in the past 5 years in running an intense medical ethics boot camp for Catholic medical student, and for which this chapter I think will become an important part of their reading list.
Have you thought about using it for pre-medical students who are still in college before they get to medical school?
I think I haven't thought through that much. I think it may have some utility for those students, particularly those who are later on in their collegiate path, maybe just on the brink of stepping into medical school. I think it may have important relevance to them. Yes.
What do you think are some of the key points that the medical student made in this chapter that those considering training in medical school should be aware of?
You know, medical school is characterized a lot, as we know, by
have a relationship with God,
knowing about diseases and things like this. And I, as I think more and more, and the author of this chapter points to this to some extent, formation in faith is about not just knowing, for example, not just knowing about Jesus Christ, but knowing Jesus Christ. And
yes.
I think this is so important, certainly in our formation in faith, but it nicely is essential, I believe, for our formation as physicians as we step to the bedside and care for patients. So I think that's...
If we think about it, there are, 130 or so medical schools?
Yes.
And there are 5, maybe, Catholic medical schools?
There are.
Something like
that. Most Catholics are going to be going to a non-Catholic medical school.
Exactly.
And, to read this will give them some foundation in how they can situate themselves as Catholics in their non-Catholic
I think we need to find some way to get this in the hands of Catholics. And I have some ideas I want to talk to you about offline about how we can do that. You have done a tremendous work in getting this out there. But I'd like to move on to Chapter 14, which is on ethics and clinical research. I did clinical research for 2 years in the U.S. Army in vaccine research. So I understand, but maybe our listeners don't understand, why would we need a chapter on the ethics of clinical research? How could it possibly be different for Catholics or anybody else, John?
Well, there's so many issues, as you know, in terms of respect to the dignity of the human person, which importantly has implications for developing, for clinical research, all sorts of issues surrounding justice, and that touch upon, in pharmaceutical industries for drug development and so on. So there are many ethical issues that are certainly very relevant to clinical research.
I think this has been coming to the forefront more even in the lay media with the vaccines. In family medicine, I get a lot of questions about how vaccines were developed, especially using stem cell lines that may have been from, aborted babies from a few decades ago. I was really happy to see that this information was covered. I think a lot of our listeners are really going to appreciate this book. What kind of closing thoughts would you guys like to add for people who might be thinking of purchasing this book, Louise?
Closing thoughts. So if God created all creation and us, he also created all the physical laws such as gravity and things like that, and everything that goes into the spiritual, psychological, biological, chemical, anatomical makeup of human beings. If we practice Catholic medicine according to God's laws, we are also practicing good medicine, and in fact the best medicine, because we are practicing it in truth and love.
And John, do you have any last thought you'd like to leave with listeners?
Yeah, to that last point regarding vaccines, besides the clinical research chapter, I take you back to the chapter on pediatrics, where the author very nicely outlines those vaccines that are derived from licit morally illicit sources and those not. So, closing thought, very practical content in this book as it relates to Catholic practice and even beyond the usual topics that you would think of. So I would like to leave the audience with that.
So you can
Very
purchase
rich
Catholic Witness and Health